Hi, my name is Leisha and I'll be your student nurse today. Today we will be performing a head-to-toe assessment. I'm going to start by first asking a few questions. I'm going to start by performing hand hygiene. Can I get your name and date of birth? After you take the patient's name and date of birth, you want to examine it with their armband. And you want to ask the patient if they have any prior health issues or any surgeries that they may have had. You want to document your findings. You want to also ask them about any type of medication or allergies they may have. You want to also ask the patient if they get an annual flu shot. Next, after that, you want to move on to asking them questions if they have any type of mobility devices, such as wheelchairs, canes, crutches, walkers, if they use any specialty devices, if they use any O2, ostomy bag, anything like that, specialized mattresses, anything like that. Then you want to make sure you assess the patient's primary language. Our patient primarily speaks English, so we want to document that, make sure that's in their chart. Then you want to assess their nutritional diet to get a field of what the patient consumes. You want to make sure that you're looking at the patient, looking at their posture, seeing if anything is just visually observing to see if anything is wrong with the patient, anything that's abnormal, I should say. After we ask our questions, we want to move on to the vital signs. I'm going to read off the vital signs. Blood pressure is 90/60 to 120/80. Pulse oximetry is 95 to 100. Temperature is 96.8 to 100.4. Respiratory rate is 12 to 20 breaths per minute. Pulse is 60 to 100 beats per minute. Then after we do that, we're going to ask the patient if they're experiencing any pain on a scale from 0 to 10, 0 being no pain at all, 10 being the worst pain that you can imagine. After we have assessed the patient's vital signs, we're then going to examine the hands. And then once we get down to the hands, while we're examining the hands, we want to take that radial pulse and examine between fingers and look for any type of clubbing or capillary refills. You want to do that on both sides as well. And then then after we examine patient, make sure you observe the respirations, the breathing patterns. We want to move on to the head, and that is where we're going to examine the patient's cranium. Their scalp, and then we're going to look for any types of lesions or masses within their scalp. After we have looked through that, we're going to make sure that the skin complexion is compatible with the patient's ethnicity. After we have after we have done the head portion of this, you're going to want to palpate the sinuses. Once we're going to palpate the maxillary, and then we're going to palpate the frontal. Then moving on, we're going to move on to the patient's ears. You're going to take your light. You're going to want to first examine behind the patient's ears. Make sure there's nothing, no lesions, bumps, masses, bruises, or anything behind the patient's ears. Then after that, you want to check inside the patient's ears to make sure there's no discharge or any blockage inside the patient's ears. After we move on from the ears, examining the internal and external, we're going to move down to the eyes. And for the eyes, we are going to you want to assess questions by asking them if they have any type of corrective lens, if they wear lenses, glasses, if they have cataracts, glaucoma, anything that could possibly be wrong with their eyes, to get an assessment, a generalization of what's going on with their eyes. After you've assessed that and asked the patient questions, you want to examine you want to get your 6 cardinals of gaze, and you want to hold your pen light out here, and you want your patient to follow your pen light with their eyes. And after you've completed that, you're going to then examine the patient's conjunctiva, sclera, and corneas. You're going to pull down that lower lid and make sure that it's nice and moist and pink. And after we do that, we're then going to We're then going to examine the patient's pupils for the reaction to light. You're looking for the dilation, and you'll compare that to your pupil gauge on the side of your pen light. And you're going to do that on both sides. After you've done that, you want to get the patient to stare off to the other side of the room. You can take your pen light or you can take your finger, and you're going to take that and you're going to move it in. And then you would state that patient's pupils are equal, round, reactive to light and accommodation. Now we're going to move on down to the patient's nose and mouth. And for this one, we're going to examine the patient's nasal spectrum, the mucosa, as well as the nasal spectrum, the mucosa, and for patency. And for patency, we're going to hold down the nostril and breathe out of it. And then we're going to do it for the other one, like that. We're going to take our light. We're going to look up the patient's nose, and we're going to look at the mucosa inside, and we're also going to make sure that that spectrum is symmetrical to the patient's face. Next, we're going to move down to the patient's mouth. We're going to examine the lips. Make sure the lips we're going to examine for color and symmetry. Then we're going to move down and have the patient open up their mouth. We're going to look at the patient's, we're going to have to look at the patient's teeth for any dental caries. We're going to look at the patient's gums. We're going to look at the buccal mucosa. We're going to look at the tongue, and we're going to look at the floor of the mouth. After we examine the inside of the patient's mouth, we're going to get the patient to smile. Then we're going to get the patient to puff out their cheeks. And then we're going to get the patient to stick out their tongue. Okay. Now, after we've moved on from that, we're going to go down to the patient's neck. And we're going to examine the neck for any lesions or masses on both sides. And then after we do that, we're going to palpate the carotid artery one side at a time. And after we have done that, we're going to have that at a 45-degree angle, and we're going to examine for JDD. And you would take your light at an angle and look. And then after that, we're going to assess the range of motion of the patient's head. We're going to have the patient move their head up, down, right, left, and then we're going to get them to shrug their shoulders. And then you're going to get them to push resistance against your shoulders. So you hold your hands here, and they will push up against your shoulders so you can assess the strength of the patient. After we have assessed the patient's neck, we're going to move down to the patient's upper extremities, examining the upper arm and the lower arm. Since we've already examined the patient's hands, you're still going to examine for lumps, lesions, masses, any type of thing that could be abnormal. And then you're going to assess the range of motion as well as strength. You're going to have the patient do flexion, extension. You're going to have them, for their accessing their fingers, have them touch their fingers, go back and forth. For their arms, for the resistance, you want the patient to push up against your arm, testing their resistance. After we've moved from the patient's upper extremities, we're then going to move down to the patient's chest area, where we would take our stethoscope and we would listen for breath sounds posteriorly, anteriorly, and laterally. You take your stethoscope and you're going to monitor in these areas, and then you would turn the patient around. And you're going to listen to lung sounds back here. And then you'll take your stethoscopes, and now we're going to listen to heart sounds. And we're going to start off on the second intercostal and the aortic valve. Then we're going to move over to the right intercostal, where we'll listen to the pulmonary valve. And then we're going to move down to the tricuspid valve, which is right over top of the breast. And then we're going to move underneath we're going to go to the mitral valve, which is right underneath the breast area. After we've assessed the patient's breath sounds, lung sounds, and heart sounds, we're then going to, and also anytime you want to also make sure that there's no lesions or masses or bruises or anything, and also making sure that the chest, the patient's upper chest is symmetrical to the rest of the body. The skin is, the skin texture, the skin complexion is appropriate for the patient's ethnicity. After that, we're going to move on to the patient's abdomen. Looking for symmetry, looking at the skin complexion, and making sure there's any lesions, masses, or bumps. You're going to also check the patient's umbilicus, and then we're going to auscultate the 4 quadrants here, assessing for any type of tenderness or soreness the patient could possibly be experiencing. If the patient's not experiencing anything, then we would get then we would have our stethoscope out, and then we would auscultate in all 4 quadrants, listening to bowel sounds to see if the patients have hypo, hyper bowel sounds. After we have assessed that, we're going to then we're going to ask the patient when they've had their last bowel movement, and when's the last time they've urinated, and eating habits. Do they eat a lot of sugary snacks? Do they eat a lot of salty snacks? Do they eat a lot of pork? Things like that. After we've examined our patient's abdomen, we're going to move down to the patient's lower extremities, and we're going to inspect for any type of edema. We're going to inspect the skin texture. We're going to inspect for any lumps, masses, lesions, any of that. After we've examined both the patient's legs, we're going to palpate pulses. We're going to first start with the popliteal pulse, which is behind the knee. And after we have palpated that pulse, we'll move on to the posteriotibial pulse, which is behind the patient's ankle, and the dorsalis, which is on top of the patient's foot. Now, after we've done that, while you're down there at the dorsalis, you're going to examine the toes. You're going to separate the toes, make sure that there's no lesions or masses in between the toes, because sometimes diabetics don't realize that. If your patient is diabetic, you still want to do it either way. Then after examining that, you're going to want to assess range of motion on the patient's hips, on the patient's knees, on the patient's ankle. You can have them rotate their ankle, and the patient's toes, you can have them wiggle their toes. And then during the whole assessment, if possible, try to observe your patient's gait, so that way you can see how well or unwell they might or might not be ambulating. After we have after we've completed our full head to toe assessment, you want to make sure that throughout the entire time that you're providing privacy and giving the patient therapeutic communication. And you want to thank them for your time. Have a good night.